Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Philippines bans travelers from India's neighbors Nepal, Sri Lanka, Bangladesh, and Pakistan as part of the government's bid to prevent the entry of new COVID-19 variants from India. Also, the health department says authorities are now locating 5 travelers from India who have tested positive for COVID-19. Health spokesperson Rosario Vergeire joins us live. And later, the Philippine Coast Guard drives away Chinese vessels in the Espada Shoal as they continue to conduct maritime exercises in the West Philippine Sea. Coast Guard spokesperson Armand Balilo is also with us on the show. Two days after taking the Sinopharm vaccine, President Rodrigo Duterte is now asking the Chinese ambassador to pull out China's donation of 1,000 Sinopharm doses. The president says he is taking responsibility after he was heavily criticized for getting the unregistered vaccine. Here's the president in his own words.
So we are sorry. You are right. We are wrong. Ang Sinopharm, maybe tomorrow or following day, wala na yan. I made it as a personal request. Ngayon yung tinurok sa akin, I said, it's a decision of my doctor. And all things said, this is my life. Alam ko man compassionate use. So there was this legal point that made it possible for me to sinabi ng doktor Sinopharm because of the record outside of the Philippines na maganda ang and all of the Chinese official Sinopharm. Pero kung parang gano'n naman ingay, i-withdraw na lang para maghintay na lang tayo ng Sinovac and other.
The Philippines has imposed a travel ban on countries neighboring India. Travelers from Nepal, Sri Lanka, Bangladesh, and Pakistan will not be allowed entry from May 7 to 14. The health department says there is still no detected COVID-19 case involving the new variant from India. Let's go straight to the source of the story. We have health spokesperson and Undersecretary Maria Rosario Vergeire. Yusek, welcome to the source. Maraming salamat muli sa inyong oras.
Good morning po, ma'am, and good morning to all of you.
Okay, so it was a decision, no? You said travel ban on Nepal, Pakistan, Sri Lanka, and Bangladesh to prevent the spread of the virus from India, as recommended by the DOH. This will begin, we said, this Friday, ano po?
Yes, ma'am. This ban, additional travel bans to these 4 countries will begin on May 7, ma'am.
Okay. Paano po yung mga in transit na, Yusek?
Well, there would be this kind of protocol where if the individuals are on transit already, that then when they arrive, they have to complete the 14-day quarantine here.
Okay, so those arriving before Friday and in transit will have to do 14 days of quarantine. What made the DOH, what pushed the DOH to recommend this travel ban?
Actually, when we had the travel ban for India, it was part of the discussions already that how about for the other countries which are affected also by this variant coming from India. And we had to confer and discuss with the WHO as well. And WHO made it clear in their recommendations that if the government of the Philippines would want to look at the other countries, and then it would be proper that we identify those countries which would be most probably having these variants already, and this would be these 4 countries.
Meron na huwang numbers on individuals who have arrived in the country from, I'll put India aside first, Yusek, from Nepal, Pakistan, Sri Lanka, and Bangladesh.
Right now we have this data for from April 1 to 30, where these individuals who have traveled just in India. So we are still getting
Okay.
figures from these four countries as to the arrivals here in the country.
Okay, so let's talk about India. I know that you have data from April 1 to April 30 so far. How many individuals arrived in the country from India or may have passed India on their way to the Philippines?
Yes, actually, yesterday we had a media forum, and our numbers yesterday was just at 117. But we had a meeting with the Bureau of Quarantine last night, and it was updated already. So from April 1 to 30, we have 149 individuals who have traveled coming from India or passed through India, and they had been quarantined here in the country.
All 149 were certain were quarantined. How many of the 149 tested positive?
Yes, out of the 149, all of them were tested either on the 6th or on the 5th or the 6th day. They were all quarantined. 137 were tested negative. 5 were tested positive, and the other 7 we are still trying to verify as to the status of these laboratories and their statuses as of now.
Okay, I'll repeat that, Yusek, ano po. So far, 137 ang negative. Pero yun pong 137 na negative, have they all been released from their quarantine facilities?
Yes, based on the existing protocol that we have, which is testing on the 5th or the 6th day, and then once they turn negative, they will be released to their local governments. Local governments has to ensure that they will complete their 14-day period in their local governments. Right. So we are getting all of the statuses of all of these individuals who were sent back to the local governments so that we can have information on this.
And 5 tested positive. Ano po, Yusek? Tell us more about these 5.
Well, as of now, our information would be that 4 out of these 5 individuals would be Filipinos and 1 would be a non-Filipino. He's a foreigner. And as to the status and to the addresses and the status of their disease right now, we are still verifying. But we got that information last night from the Bureau of Quarantine. Only 1 remains to be isolated. So meaning the other 4 has already recovered.
4 have recovered, 1 remains in isolation. So if it totals 5 positive cases, kailan po bang padala yung kanilang tests for sequencing with the Genome Center?
Yes, we have already coordinated with the regional office and the Bureau of Quarantine so that we might be able to get the samples of these 5 positive individuals, and we will be processing through the Philippine Genome Center for the whole genome sequencing.
So just to be clear on this, hindi pa po nag-uumpisa yung pag-sequence nung 5 na nag-positive from India or had passed India. Hindi pa po nag-uumpisa yan with the Genome Center.
Not yet, Mama. We are still trying to retrieve the samples of these 5 individuals.
How important is it to begin the sequencing of those who tested positive?
Well, biosurveillance is very important. It's very critical at this point of the public health emergency because we want to detect if there are specific variants that these individuals had been infected with so that we can contain the transmission. So right now, every time that all returning overseas Filipinos and OFWs who comes in the country and turns positive, we subject them to the whole genome sequencing.
Yung pong 4 who have been released now because 5 were positive, yung pong 4 that have been released, would you be able to assure the public, Yusek, that the public is safe or hindi na po sila makakapanghawa? Because they could possibly still be with the LGUs.
Yes, so that is the hope that the local governments are ensuring that the 14-day quarantine period is being complied with. So that is our protocol right now, that after being tested negative, they can be endorsed to the local governments, and local governments have that responsibility of completing this 14-day quarantine. Another thing that we have would be our surveillance system. So if ever they are sent back to their local governments and there would be like they are incubating and we were not able to catch that disease during the 5th day of testing or 6th day of testing. And then with this surveillance system that we have, we are supposed to catch them and identify these people who are sick.
But has the DOH coordinated with the LGUs of the 4 positive patients who have been released? Any update on that?
Yes, that's part of the protocol, Pinky, that whenever we identify positive cases, we will be coordinating with our local epidemiology and surveillance units to inform them and also for us to get that information as to their statuses. So last night we have started coordinating and we will get the information within the day.
And are you at liberty to tell us which LGUs these are?
I cannot give that information yet, Pinky. We still need to coordinate with the local governments before we can release any information.
Okay, so that is, we'll probably get an update on this by today. Yusek, papaano po yung isa who remains to be in the quarantine facility? Just added information on this. Kailan ho dumating at bakit nandun pa?
Yes, added information, Pinky, we're still trying to get from the Bureau of Quarantine. And as I've said, we will be completing our information within the day.
Okay. So are you looking for other individuals who may have come from India or had passed through India na hindi pa po nahahanap either through the quarantine facilities, through the Bureau of Quarantine?
Well, as of last night that we received this information, the line list from the Bureau of Quarantine, we've tried to match these individuals, 149 in this list, with our listing also coming from DOH. And as I've said, we're still trying to verify 7 of these individuals. Not that we need to locate them. There are addresses already. We've informed our regional epidemiology and surveillance units. We just need to match them as to the presence or the laboratory results and also through our data systems in the COVID Kaya. So as I've said, all of these are being done by DOH right now. And hopefully within the day, we will be completing all of the information for these 149 passengers.
I understand. But just a question on the 7 that needs verification. Can you just give us more information on that? Bakit ho kailangan i-verify? Ibig ho ba sabihin nun, mali yung address, hindi nyo po nahanap, o meron lang mismatch between the DOH and the Bureau of Quarantine numbers?
There are some missing data, Pinky, dun sa line list ng Bureau of Quarantine. That's why we cannot have that complete verification. No? So may mga iba-iba hong detalye na hindi po nakasama dun sa listahan na yun. At yun po ang pilit namin kinukuha kagabi pa. But as to these 7, ito po mga bine-verify namin, 3 po dito Pilipino at 4 po ay foreigners. So ito pa lang ho ang informasyon na meron tayo. We're just completing the details. And as I've said, hopefully within the day we get to complete the 149 information of all of these individuals.
But these 7 individuals that you need to verify, did they all test negative?
Yes, that was part of what was written in the line list. So we're just trying to verify because as I've said, the details were all lacking. But apparently, according to POQ, all of these 149 individuals were tested on the 5th or the 6th day. And all of this, if ever they turned negative, were endorsed to the local governments.
Just also to a follow-up on this, is the DOH or the Bureau of Quarantine or the LGUs looking into the possible close contacts of those who tested positive? And if so, how many are they?
Yes, so that is a part of the protocol, Pinky. As soon as we identify a person who turns out to be positive, we need to immediately do the contact tracing. And as for these individuals who turned positive, they arrived in the country, they got isolated or they were isolated as soon as they were identified to be positive. So meaning they were quarantining already, we just transferred them to an isolation facility when they turn positive, and contact tracing starts from there, no? So ibig sabihin wala pa ho tayong masyadong nakikitang mga contacts na
Close
nakasalamuhan nila sa komunidad dahil from the airplane, from the airport, they were already quarantined.
Tapos from there, hindi na po sila kasi nakaalis doon. So we're hoping that walang close contact, but there could possibly be a close contact in the plane.
Yes, that is part of the protocol, Pink. As I've said, as soon as they are identified positive, the Bureau of Quarantine starts the contact tracing already. And especially those coming in na nakasakay sila sa aeroplano, maraming pasahero, yun po yung atin pong pinagtatrabahuhan kapag ganyan.
Right. And Yusek, hanggang ngayon ano po, wala pa po itong variant that was found, discovered in India, this double mutant na nakikita po dito sa Pilipinas.
We have not detected that yet. Since the start that this double variant or alleged double variant from India was announced, we tried to reevaluate and review all of our data systems in the Philippine Genome Center. And according to the Philippine Genome Center, until now, we have not detected this variant yet.
Understandable, but it would be very important, I'm assuming, na itong nag-positive galing from India or had passed India, ma-sequence kaagad ng Genome Center to really identify if nandito na po o nakarating na po itong virus from India as well. Ano po?
Yes, that's right, Pinky. So as I've said, all returning overseas Filipinos or all travelers coming in the country, when they get in, we do double samples. So ibig sabihin, we do a sample or a swab for the RT-PCR, and then another sample is taken from the individual so that we can be able to send it over to the Philippine Genome Center if ever they turn positive para mabilis ang proseso. Right. So yes, whole genome sequencing is very important. It's going to be done.
Okay. Maraming salamat po sa inyo, Health Spokesperson, Undersecretary Maria Rosario Vergeire. Thank you, ma'am.
Thank you.
And